Welcome back, everyone. Mercy Medical Center in Springfield confirms to Western Mass News. Several patients have recently been placed in self-quarantine after presenting with symptoms that are consistent with COVID-19.
Well, tonight we get answers from Mercy's chief medical officer, who makes it very clear that no patients have tested positive for coronavirus. However, they and every hospital in the state, he says, are working closely with the Department of Health to separate those at risk.
Without giving a specific number, Mercy Medical Center's chief medical officer, Dr. Robert Roos, tells Western Mass News, providers recently identified several patients they felt should be tested for COVID-19.
We have been in communication with the Department of Health about some cases that we were suspecting would need to be tested, and their advice in those cases was to hold off and not test.
Right now, the state holds all COVID-19 testing kits. They make the determination to test or not to test. In these cases, Dr. Roos says the state determined the patients in question did not quite meet the testing criteria.
After the provider does an assessment in the communication with the state, if it's felt like that risk is relatively low, well, then in those cases, the decision has been not to test. If the risk was considered to be very high, then it would have been a different answer.
However, he says out of caution, those patients were placed in self-quarantine and state officials are monitoring their status. Dr. Roos says other hospitals throughout the state are dealing with similar situations and are taking every precaution for patients and for staff.
If there's a concern that there would be an infectious exposure, as staff, we take those proper precautions of utilizing the personal protective equipment, and if we need to, utilizing special rooms in the hospital to care for those patients.
With the national number of confirmed cases of COVID-19 climbing daily, doctors advise people not to press the panic button, but to know the symptoms, including fever, cough, shortness of breath.
These are some of the same symptoms that we see in influenza, in common colds, and other types of respiratory illnesses.
How do you know it's something more?
If you've been somebody who has suffered from allergies or had the common colds in the past, and you try those usual symptomatic treatments that you might use and the symptoms go away, that's a pretty good sign that, what you're treating is what you think it is.
However, he says if symptoms persist, it might be time to call your doctor.
And late this afternoon, the state public health commissioner announced that new kits to test an additional 2,000 people are now available and more are on the way.